super easy. I'm not doing this. I'm not doing this. This is the best aseptic way to do it. Squirt, squirt, squirt. And then you're going to practice screwing it on, right?
Squirt, squirt, squirt.
So we're good. And
Don't say it like that.
I'm going to power this by air.
Do I need to bring my items?
Bring my equipment.
I want a new nebulizer. Mine's broken. See? Doesn't matter.
Well, you can always twist this where it ain't gonna work. Right? So you just twist it where it's on there and it's gonna stay. I mean, because it just depends on your chest too.
Yeah. But you can bend it too.
You can bend it around to make it fit, right? Or, let's see. And optimally, what? The optimal position is already upright, as high as they can go or tolerate to help gravity do it. But sometimes, you know, they've had a procedure or whatever, and they got to stay just like this, right? So then you just tweak it so that this is upright and this is on their face like so. It's not real hard. But you just got to practice tweak. Notice I'm doing all the tweaking right here and not right here. It'll move a lot easier up and down right here as opposed to right here. So do we warn them in advance that a little bit may get into their eyes? Well, here's what I'm going to do too. I'm going to minimize that like so. But if they do, remember there's like sympatholytics, parasympatholytics can cover. Well, if they get enough absorbed in their eye, then you just tell them, you know, close your eyes a little bit here. Generally, that's not a problem. Generally, if they're laying down like this, they're usually have their eyes closed anyway. All right. Take this off. Notice I have, just like oxygen therapy, have the flow of gas, flow of aerosol, which is powering this, going. All right, here's the treatment bag, and like I said, we would drain this out, clean it out, and then just be hanging up something like that. Next treatment. Now, you know, Mrs. Smith, now she may not stay on her side, right? Whatever was the reason, they put pressure, she had a cardiac cath or whatever. Now she can sit up. I'd want to position her on her back as much as possible. And go, all right, you tell me as high as we can go here. The higher the better. You know what I mean? And then they go, oh, you know, because they may have an incision or whatever. Okay, that's okay. And then you would adjust it and so forth. This height, I would probably do this type of setup. They would really need to get, move this before I yank it out of the wall. Really about right there minimal before I would switch to just an upright mass setup like so, right? Because that's pretty upright.
Mm-hmm.
All right, something to that extent. There you go. All right. Six to 8, some textbooks will say 6 to 10. Let's look at drawing up heads over here. We'll let Annie have her treatment. And then maybe we can also listen for the sputter, the sound changes. All right, most of the medications we use come pre-packaged in what we call unit doses. All right, so, and you'll see most of the time they come in 3 cc solutions. 3 cc's, why? Well, because the equipment we use, it needs 3 cc's to nebulize properly. So, not all, like look, here's 2 mils. 3 mils. 3 mils. You just keep going. But this is 3 mils too. All right. So what you have is you have the active ingredient, the amount of active drug, and you have it just diluted or mixed with sterile. Not sterile water, I take that back. 0.9% sodium chloride. So it's sterile
Saline solution.
saline. Jeez, saline. Alright. So when you have that, I mean, you can just pop the top. Usually I just have y'all practice with this. Same exact stuff, just normal saline versus a drug that's kind of sticky and smelly and exposes you to an expired drug. Have it upright, don't pop it like that because it's you're gonna squirt some of the meds. So upright, and then just twist it off, and it's ready to go. Okay. So like I said, some of them, like this one, straight shot. There's no ledge, right? There's no any obstruction. It just goes straight to the cup. Now what's obstructing it a little bit is the baffle. You can see the baffle in there. But you'd probably be okay to just go. Notice I'm not, right? I'm not even touching it. But I've got really good control of it because this is touching this, and it's just like a super easy. All right, don't make it hard. Then we're ready to go. If I was doing it from the side, once again, just give you a little close up. I just open it up and I don't go, because you never know what's going to touch it. The more you open this up, the more something can touch it and contaminate it. So you just open it up barely, wrist touch wrist, and I can squirt it in there without touching anything. Right? It's inside the little capsule. It's not squirting it from afar, but it's not even needing to touch it. You're just aseptically putting the liquid in.
We do have to put the meds and to clean it out.
Yeah, I mean, when you're doing it, you can do it a little bit from afar. Just kind of make sure you don't squirt yourself. That's embarrassing. All right, drawing of meds. Generally, we use a 3 cc syringe. Sometimes you'll see 5s, sometimes you'll see 1. So this is like a 1 cc, this is a 5 cc, this is a 3 cc, 135. Okay. If I'm going to be drawing up like greater than 3 cc's, obviously I'm going to be using this. But if I need less than 3 cc's, optimally you're going to use the right size syringe. So if I need somewhere between 1 and 3, this is what I'm going to use, right? Greater than 3, this is what I'm going to use. Less than 1, this is what I'm going to use. Okay? Needles and or what they call these needleless systems. That's what they call the needleless medication prep cannula. That's a mouthful. But it is basically a plastic version of a needle. So it's got a little sharp point to it, but instead of doing this, I'm not literally going to break the skin. If I had a real needle there and was doing this, it'd be like poking the skin, right? So it's a little bit safer. Can you still jab it in you? Absolutely. Okay, but it would take much force than it would with a needle. So a lot of times when we're drawing up stuff, we're usually drawing up like a portion out of something like this. So let's just grab it. This is what we just call a liquid ampule. 0.9% sodium chloride. So normal saline. You gotta get where you can read this stuff too, because you're gonna confirm what the heck it is. Which gets more difficult as you get older. But you'll need to find where the writing is on this. So this is ipratropium bromide, which you're going to find out it's a parasympatholytic, and it's 0.5 milligrams in a 2.5 ml solution. That's what's in this thing. And we're going to do drug calculations Friday. This is 2.5 milligrams of albuterol in a 3 ml solution. Now, the good thing about this is it has a big A on there. All right. Now, but the product name for ipratropium bromide is Atrovent. That starts with an A. So anyway, read it. You're going to confirm the medication. A lot of times we're going to squirt in whatever this is, and then we may need to add some normal saline. Or, we may decrease the dosage in this. Either way, you're going to, let's say, draw up some meds. So I'm going to get the proper size syringe. I'm trying to see. I guess all my packaged ones are already unpackaged. Oh, here we go. This will show you. So, 3 ml syringe looks like something like this. If or whatever